If you're enjoying these podcasts and learning something, make sure to hit subscribe, share, and like.
That's good.
All right. Welcome to the Alfi podcast. This is episode 4. I have a very special guest, Gigi, Michelle Zoltan. And today we are going to talk about Botox, fillers, and all the Bandaids. I know you see a lot of this stuff in your world, and let's get into it. So we had a conversation recently about a lot of things you were seeing in your world, that people were doing fillers, Botox, and you had mentioned to me something that you observed.
Yeah. So on social media, I spend quite a bit of time on social media, partially because, it is a part of my job, but I also enjoy it very much. And I spend quite a bit of time on TikTok. And my question to you was...
TikTok University?
Yeah, TikTok University. I learned quite a bit on that app. But what I normally see on my For You page is a lot of women, my feed is very much catered to makeup, self-improvement, fashion, all of that. And something that I see constantly on my For You page is people talking about Botox for TMJ pain and also filler for facial balancing. And I wanted to ask you your opinion on, is that a Band-Aid? Is that something that is going to last long term? Of course, we know there's actually a lot of studies that have come out that have mentioned that filler doesn't dissolve as quickly as people are told, which is a little bit controversial, right? Because they would tell you that filler dissolves after 3 months, 6 months, you go back, get it redone, and then the cycle continues. However, is that dangerous with facial balancing, with people constantly getting filler? But then also, it's like a very loaded question here.
Yep.
So
we'll break it down. So we're talking
down.
about Botox for TMJ, and we're talking about the use of fillers to mask facial imbalances or deficiencies.
Correct. Yeah.
Their utility, their risks and benefits, and the question you're asking is this a Band-Aid?
Is it a Band-Aid? Is it dangerous? Is it something that's reversible?
Right. Yeah. So these are great questions, and they're great because they're so common. And, I'll even see these in my feed because I'm in the world of...
Probably because I run your social media.
Probably because you run my social media. There's probably some cross influence on there.
Yeah.
Let's start with the Botox question, right? So Botox is used pretty commonly now for injection into the masseter muscles.
Correct. Yeah.
Which is a major clenching muscle of the face. Pounds per square inch, the masseter muscle is the strongest muscle in the body. I don't know if you know that.
I did not know that.
Yeah, so it's a really strong muscle. And then the temporalis muscle, the temporal muscle.
Okay.
So these muscles usually are injected with Botox in people that have severe bruxism, which is severe clenching or grinding. And that severe clenching or grinding is attributed to muscle pain and soft tissue pain in the face. And these are usually categorized as TMJ disorders or TMJ pain. It's really kind of a confusion.
Right.
But really they're hyperfunctioning, inflamed muscles from the extra work of grinding and clenching. So a lot, providers have been using Botox for this indication for a long time now, even since I was a resident. We were doing it. This was 15 plus years ago. And there's a lot of data that it shows that there is efficacy for decreasing some of the symptoms of bruxism or the frequency and intensity of bruxism, because essentially what's happening is the Botox is affecting the neurotransmitters and the ability of the muscles to function. So it's relatively safe. There is some risk that it can affect chewing function because it can decrease the muscle maybe adversely a little bit. But in general, it's a safe modality. It's a safe option for decreasing symptoms. Now, the problem with that, and this is something that we talk about a lot, is that it's
Mm-hmm.
definitely a Band-Aid.
Right.
Because what is the actual cause of the clenching or grinding or bruxism that's causing that pain that we're calling TMJ pain or facial pain or whatever it is?
Right.
And just hitting the muscle with a drug is really just putting a Band-Aid on it. We're treating the symptoms and not actually even thinking about the root cause. We know that most people have sleep apnea or airway
Yeah.
disorders, and that people with sleep apnea or airway breathing disorders have a high tendency to clench their teeth and grind in order to activate the muscles in the face and keep the airway open. So clear association. So we definitely want to see these patients and look at the pain that they're having and the extra clenching and the hypertrophic or large masseter muscles as a sign of something greater, and that greater can definitely be an airway issue, right? There are other things like stress and side effect to some neurological drugs or neurological disorders even that can cause bruxism and clenching. But in most people, it's going to be the airway, and it's something that should be definitely ruled out
Mm-hmm.
to make sure, because it's not only, that's just a sign, but if someone has sleep apnea or airway disorder, we know what can happen to their body physiologically and their quality of life. The quality of life can suffer for sure. Brain fog, memory loss, concentration, ADHD, anxiety, depression, insomnia, all these things. But even physiologically, high blood pressure, decreased metabolic disorders, risk for stroke, dementia, all these things that are obviously associated with sleep apnea. So I think that the problem with people doing these injections is that we're not actually paying attention to the root cause, which can have real grave consequences for the person. The other problem is Botox is expensive.
Yeah, I was gonna say, I mean, isn't a session, I think, don't you get like maybe 3 or 4 units per, because it is such a big muscle, right?
Mm-hmm.
I mean, I don't know the details. I've never gotten Botox.
Yeah.
So I don't really know exactly like
Yeah.
what the ins and outs are, but I do know from friends that they do get quite a few units per appointment. And then afterwards it wears off depending on how fast your body, metabolizes the neurotoxin. It could wear off anywhere between 3 months to 6 months. So then you're back at it again. So like at that point, in me personally, I feel like it is a Band-Aid.
Mm-hmm.
But do you think with Botox, because it's constantly causing the muscle to atrophy, do you think over time it could cause like permanent damage to the muscle?
Yeah, I think over time it can cause weakness for sure.
Mm-hmm.
And, the long-term effects have never really been studied. There are a lot
Right.
of studies and...
'Cause it's kind of like a new age thing.
Right, and there are systematic reviews that look at studies, but all these are really short-term and small number studies. So for sure, continuous weakening of the muscle can cause atrophy, and then who knows about the neurological potential of those
Right.
muscles long term. It's a good question. The other thing is you're actually spot on. It is 3 to 6 months. That's actually what you'll find when you look at these systematic reviews of multiple studies. That's very accurate. It's the 3 to 6 month window of efficacy for the Botox. So someone that's really using it as a Band-Aid, you're looking at being a repeat customer 3 to 6 months and going through these painful injections.
I mean, yeah.
And you talked about the units. I can speak to that. I personally, as a provider, I buy a bottle which is 100 units of Botox, and that costs me somewhere between $600 and $700 per bottle.
Mm-hmm.
Now, for the injection of the masseter and temporalis on both sides, we're using pretty much the entire bottle
Oh,
per
wow. So
patient.
it's 100
Yeah, you're talking about
units?
25 to 40 units per side.
Oh, so I was totally
A muscle.
under.
Yeah, so just the material cost to the actual provider, you're looking at 600 to 700. So
it's going to cost
yeah,
the
I mean, if you're a patient coming here to do it, I can tell you that it's going to cost $1,000 to $2,000
Yeah.
per session. And
I didn't realize
you're talking
that it
about
was
every
the whole bottle.
3 to 6 months. Yeah.
That's
So
crazy.
yeah, that makes a obvious issue. That's an obvious concern for someone to think about doing something at $1,000 to $2,000 every 3 to 6 months, unknown long term effects. But I think the biggest thing, put money out the window, put time out of the conversation, and the pain of the needles out of the conversation, because there are proven alleviation of symptoms using Botox. Put all that aside, I think there's a huge issue of not identifying the root cause.
Right.
And something that's potentially really affecting someone's quality of life in way more fashions or way more categories than just the TMJ pain that we're calling.
And also, I just remembered another thing that I have been seeing like an uptick of on my For You page is people getting Botox in their shoulders and their trap muscles, which could also be from Airway, right? Or I mean, it could, speculation, but I'm seeing an uptick of that too, which is also interesting because I mean, obviously that's going to be way more Botox than what you're putting in your face.
Yeah, I'm not familiar with Botox for those indications. I can't even imagine what units you would need to affect those. But it is true. A lot of people with neck and shoulder pain actually have airway issues. And when those airway issues are addressed or fixed, for us with double jaw surgery, those symptoms go away. So whatever it is, whether that's true or not, I think as physicians or healthcare providers, I think that we should really start to have this paradigm shift where we're looking at root causes and trying to find out, what are these signs and symptoms, and identify them as signs and symptoms and not just something to treat.
Correct. Yeah.
Right.
Yeah. And then like talking about filler too, what I'm seeing in your patients over time is we have a lot of patients who will come in, with lip filler. They have a ton of lip filler when they come in, and then post-surgery, magically, they don't have lip filler anymore.
Right.
And it's, I mean, not just that, there's other types that people get, but what I have seen a lot of correlation between is once they do get jaw surgery and they are, their bite is fixed, their function is fixed, and they're aesthetically more pleasing and they're a little bit happier with the way that they look, magically they don't have lip filler anymore. But they still have fuller lips because they have the proper support from their maxilla. But my question is, another thing that I've seen is like facial balancing with filler. Like people will get injections in their chin, and then injections in their cheek area.
Even the nose. Even
the nose when like it's like a liquid rhinoplasty.
Right.
So I know that we've talked about this, like how with facial balancing, it could sometimes be soft tissue that needs balancing. But do you think, what do you think the percentages between like, no, you have to get your hard tissue, your bone structure fixed versus it's a soft tissue issue? And then on top of that, filler doesn't always dissolve. Most of the time it doesn't. And then it migrates. And then the dangers of like pillow face from that too.
Right.
And then you don't even look like yourself anymore.
Yeah.
So it's a loaded question, but.
Yeah, no, well, I can address all those. That's a real issue. When I learned about fillers, and I used to use them in residency and in early practice, we learned that fillers dissolve after some time, some months. Right. You're right. What we're learning is that we actually don't know how fast those things dissolve or if they dissolve at all.
Well, before you continue, have you seen that video of that one plastic surgeon who did a scan on a woman who had a ton of filler within, I think, a year? She did a couple units, and he did a facial scan on her, and he thought it would have dissolved by like 6 months.
Right.
And it was still there. Yeah. And it just migrated.
I don't know if I've seen that one, but I see it here in our CT scanner, our cone beam CT scanner, because a lot of our patients, this goes to your other question about, soft tissue versus bone. Most of the time it's the underlying bone that's a problem. There are some soft tissue asymmetries, but for the most part, the majority of patients have asymmetries in their bone structures or deficiencies in their bone structure,
Mm-hmm.
and they're trying to fulfill their desire for more harmony or fullness by using injections. So a lot of our patients, by the time they come to us to seek double jaw surgery, they have gone through fillers, injections, and some of these patients will say, "Oh, this was, a couple of years ago or 6 months ago or more," and we'll see them light up on the CBCT scan way longer than these patients anticipate that they'd still be there.
Yeah.
So we see that we can probably find some X-rays to share on that. I think I saw one yesterday actually,
Yeah.
with fillers in the cheek. And you're right; they also are known to migrate and
Mm-hmm.
cause changes to the soft tissues, inflammation, scarring, changes in the density, and these pillow faces or different terms that you describe of people getting them over consecutive years
Mm-hmm.
or for a long history of having them, their faces don't look well.
Yeah. I mean, I'm all for like self-improvement and
Mm-hmm.
doing what helps you feel best
Right.
about yourself. And, you know, I mean, I wear makeup,
Right.
and it makes me feel
For
more
sure.
confident. But if it makes you feel more confident, support it. But I think sometimes people with filler have gone overboard because they're not getting the results that
Right.
they're
They're seeking something.
seeking
Yeah.
right away.
Mm-hmm.
And then it just turns into this downward spiral of like
Yeah.
body dysmorphia.
Mm-hmm.
And then they're not seeing, or they are seeing what they're
Yeah.
not, like what's really not there. And I just think with like filler, it could be very dangerous in the long term because we don't actually know how long it takes to dissolve. And then you're over here thinking, like, some people, I've also seen horror stories where people have gone in to dissolve their filler and it doesn't dissolve. And then it's like, what was injected into your face to begin with? It's a very fine line that we're walking
Mm-hmm.
as far as like improvement. Because I also think a lot of women are victim to that
Right.
from the plastic surgery side. This is kind of like my opinion on it, is a lot of women are told like this is a quick fix and this will make you feel more confident and happy with yourself, and then they fall into this trap of going back and getting filler and more and more and more, and then they become a lifetime customer, and then they end up messing up their faces. It's like, it's really sad because where's the end of that too?
Yeah. There's a lot of treatments in medicine that are not great.
Yeah.
Really, all the medicine right now is so focused on treating signs and symptoms, and that in and of itself is an issue.
I feel like when we're treating signs and symptoms, it becomes kind of like an experiment.
Yeah. It's
You know
missing
what I mean?
it's missing the point of it,
Yeah.
because as, in medical school, what you really are supposed to understand and learn, this is something that I would really pay attention to, is these findings that patients would come with are pieces of a puzzle. They are signs, they are symptoms, and the real skill and real fun of being a physician or doctor is looking at these things as clues to something that's greater, so you can actually address it, fix it. This is what I call the root cause.
Mm-hmm.
Unfortunately, there's so many things to address, and people are suffering in so many ways that putting that Band-Aid, throwing the pill is maybe the most convenient but not the best thing to do. So
Right.
and there's incentives on different sides of or different parties that may influence the distribution of these things too. So there's a lot at play.
I also think celebrities have a huge hand in
Mm-hmm.
why so many, I mean, social media it's a double-edged sword, right?
Mm-hmm.
With social media, you have a really great thing, but you
Right.
can also have a very destructive thing. And I also think there's a lot of comparison when people see so many beautiful people on their screens, right? Like, the human brain is actually not designed for us to see as many faces as we do today.
Yeah.
But I think social media and also celebrities have a huge influence on
Mhm.
why there has been such a big uptick of plastic surgery in general, is it the best solution for every single person? Just like how jaw surgery isn't always the best solution for every single person. Like, not every person needs it. But I think when, you know, you are suffering with an issue like airway and obstructive sleep apnea, and you're suffering with the symptoms of that, there is a disconnect. I think a lot of people don't actually realize that airway and everything in your mouth is related to your health.
Let me unpack that. There's a lot going on.
There's a lot going on
in
there.
that. Let me start with, it's true that you talk about the influence of influencers and celebrities and social media, and the fact that a lot of people are putting filters on.
Yeah, you don't actually see real faces.
The faces that you're seeing are not always real, and the ones that you're seeing there's a selection bias to show the best faces, but a lot of them are not real, right?
Yeah, that's true.
So that's one factor of, you know, people have envy of, you know, that face is so perfect, so balanced, and I want to achieve that, and there's these quick fixes to try to target those things. That's one thing.
Hold on, before you go on to the next, don't forget your thought. But before you go on to the next one, that also causes a lot of inward insecurity in people.
Sure.
Because they see all these beautiful faces that aren't always 100% real, correct? Because there's filters on there.
Right.
And where does the individuality come in? Because then eventually everybody ends up looking the same.
Yeah, with all these fillers, they can end up looking the same.
Yeah.
But yes, so it's true. There's a false sense of reality, and I would say maybe some unreasonable expectations too when you see these things that are not really real.
Yeah.
Right. And then the other problem is that, you know, when I was growing up, there were no cell phones.
Yeah.
Believe it or not.
I can.
There were no pagers. At some point, there were pagers.
When I was born. Okay.
Okay. And then, you know, we got pagers. I was in junior high with pagers, and then I didn't have a cell phone until I think I was in dental school.
Oh, wow. Okay.
Yeah, I may have had one in college.
I had one in high school.
Yeah. But even then, they didn't have front-facing cameras. Actually, they didn't have cameras at first, but then when they did, they didn't have front-facing cameras. So there was no such thing as a selfie.
Right. Paris Hilton invented that, by the way.
Yeah, did she?
Yeah, she did.
Interesting. But those things didn't even exist, right? And then now everybody has a front-facing camera, and everybody's looking at themselves all the time.
That's very true.
And there's also social media platforms where you're posting your face and taking photos of yourself. So we're looking at our face in ways that were never encountered in human history. And then and I can tell you this as a surgeon who treats faces, there was a clear change after COVID. A clear change
in the amount of patients
in the amount of people that were looking at their faces and thinking and pointing out flaws, because what happened was people stayed at home,
spent a lot of time on their phones.
No, that yes, but also when they started working remotely, all the meetings became Zoom meetings.
Oh yeah.
And I don't know if you notice when you do a Zoom meeting, but you see your face during that entire meeting pop up in a window. That's
true. And actually, I've seen some funny memes on Instagram, people saying like, oh, I'm on a Zoom meeting, and they're staring at themselves the entire time.
Correct. So it's unavoidable now.
Yeah, that's true.
People are forced to stare at their faces. So whether they want to by taking photos or they don't want to, just going to work and showing up at work, you're staring at your own face, and you're going to pick up things that never would have been even appreciated beforehand. So, and I saw the change in patients and how many people were pointing things out in their asymmetries and deficiencies because they're staring at their faces. And there's no doubt that there's a greater interest in these things. So this for sure attributes to the boom in plastic surgery, fillers, implants, and all such things. But that is something that we need to think about, because to take it with some grain of salt, that one, we're looking at people with filters and not every face is symmetric or perfect.
Right.
But also, too, that maybe shouldn't be looking at ourselves this much. It's not a natural human process, right? But that's one thing. The other thing is that why are people getting fillers? Why do they want these things? And it's, whether it's the nose, the liquid rhinoplasty, it's the cheeks, the chin, the lips, the under eyes, whatever it is. Usually there is a deficiency in a skeletal structure, and these fillers are there to really mask the real issue. The problem is that if you're masking this skeletal problem, you're only looking at it from a very superficial aspect and not really considering if there's a functional component to that skeletal problem. And I can tell you that almost always there is. So like you said, we have patients that use a lot of lip fillers. They have huge lips before double jaw surgery, and then after double jaw surgery, they have better support of their lips and they stop getting that. One is the support when the jaws are deficient or weak, the lips are flat and have no support. So they require fillers to look more plump or better, and bringing them forward helps that. The other is that because there's an underbite or overbite, or the teeth are very long or they're too short, the lips are filled to hide that.
Yeah, because they're hiding
to mask that. A lot of times these people are seeking fillers and they're really not understanding that there's a skeletal problem, like a jaw deficiency or skeletal asymmetry or abnormality that's causing that, that desired effect, or that desired effect they're looking for is really there's an underlying cause that's skeletal, and there's a functional component to that needs to be addressed. So jaw surgery and skeletal surgery is obviously the ultimate tool for that, because it's going to give people a permanent effect of what the fillers are trying to address or the implants are trying to address, but also help with the functional components of it.